nurse today. Can you please tell me your name and date of birth? Okay, great. I'm just gonna pull a skirt for privacy. So, Z, I'm here today to do a head-to-toe physical. Is that okay? Do you have any questions? Do you have any parts of your body that you would be not comfortable with me touching? Okay, so I have all of my equipment here, I hope, my stethoscope, and can I give you this gown? Wonderful. Do not have to ask allergies. I know it's on there, but do not have to ask allergies. So, a couple questions, just to start with. Are you currently in any pain? Have you had any fever, chills, nausea, vomiting? When was your last bowel movement? Yeah. Okay. In addition to you were able to tell me your name, but do you know where you are? And do you know what day it is? And can you tell me what 2 + 2 is? Excellent. Excellent. Okay, so you're maintaining eye contact and you're appropriately dressed for the weather, so that all looks good. All right, I'm just going to go ahead and touch your head, if you don't mind. So just by looking at your scalp, I don't see any alopecia. I don't see any mites or lice, and that looks good. So I'm just, you can sit up. Okay, just palpate your head as well. And your head is normocephalic and atraumatic. So if I just look at your face, your eyebrows are symmetrical, the same height, your cheekbones look good. So I'm going to test cranial nerve number 7. Can you please smile for me? Can you frown? Can you puff out your cheeks? And can you raise your eyebrows? Excellent. Make me figure out all these things. So your temporal artery is a 2+. Can you then open and close your right one? Excellent. I don't feel any crepitus when you do that. And can you just clench your jaw? It's getting worse. And don't let me open it. Good. So that's cranial nerve number 5, trigeminal for motor, and that's really wonderful. So now I'm going to test sensory. Okay, close your eyes, please, and tell me when you feel this. Wonderful. Okay, can you open your eyes for me? Yep. So I'm just going to test cranial nerve number 2, which is optic. Hold this 14 inches from your face. Can you please cover one eye and read the lowest line that is comfortable for you from left to right? 4, 2, 6, 7, 3, 9. And can you please switch eyes? Cover the right eye now and read the lowest line that's comfortable. 4, 2, 6, 7, 3, 9. And uncover both eyes and do the same thing now. 4, 2, 6, 7, 3, 9. Excellent. Here. Now I'm going to test cranial nerves 3, 4, and 6, which are ocular motor, trochlear, and abducens. I'm just going to have you follow this pen light. Shake, shake, shakes. So I'm just looking for nystagmus. I don't see any. Eyes burning. Looks good. I'm just going to test, look at your eyes for pearl. So if you can just look straight at me for a second. And you are, this is really bad. You're about a 5. And then do direct, sensual, direct, sensual. So your pupils are equal, round, reactive to light. So that all looks good. And now, looking at your structures, so your eyelids, can you close your eyelids for me quick? And there's a scaling, there's no lesions, your eyelashes are all intact. Can you open up your eyes? Sclera are nice and white. Can you grab your eyelids, pull them down? Conjunctiva is actually a little pale. Sorry, that's okay. I'm just letting you know it looks pale. All right, you can let go. So your nose is midline. I don't see any lesions. I'm going to test cranial nerve number 1. So can you press on one side and breathe in and out? And then press on your other side in and out. So your nares are patent. And can you please close your eyes and then tell me what you smell? And then can you please keep your eyes closed and then plug your other nostril. Breathe in and out. Okay. I think it's supposed to be. All right, so now looking at your ears, looking at outside of your ear. I don't see any deformities. You don't have any drainage coming from your ear. No lesions are present. And then on the other side, same thing. I don't see any deformity. I don't see any drainage. And I don't see any lesions. So I'm just going to test cranial nerve number 8, which is acoustic. I'm going to say 3 words. If you could just repeat them back to me. Can you please plug your right ear? And could you plug your left ear for me? Good. Actually, repeat this again. So now, looking at your mouth, your lips are intact, there's no cracking. Can you please grab your lips, pull down so I can take a look at your teeth, and then pull up, and they look good. All your dentition looks good. All your teeth seem to be there. So if you can then just open up your mouth, I'm gonna take a look at your tongue first. Can you stick your tongue straight out at me? Great. Actually, close your mouth and stick out your tongue too, because we'll do that now. So testing cranial nerve number 12, hypoglossal. There's no fasciculations and no deviation. Can you say light, tight, dynamite? Light, tight, dynamite. Okay, I'm gonna open your mouth again. And looking at your buccal mucosa, it is pink and moist. I don't see any concerns with that. Lift your tongue up. Floor of your mouth also is pink and moist. Look at the palate. Both the hard palate and the soft palate also are pink and moist. Now, if you could stick your tongue out, say ah, ah. Excellent. So we have a vagus nerve number 10 is intact, is saying ah, uvula did not deviate, and her soft palate rose, and her tonsils, you say it again? Ah. So you have a 2 on this side and a 1 to a 2 on that side. Oh, I would hope I could tell that. That looks great. All right, so looking at, so now moving on to your neck, just looking for symmetry. I don't see anything asymmetrical, masses, anything that's pulsating. Can you please take this and take a swallow for me? Testing cranial nerve number 9, glossopharyngeal. That looks great. Now we're going to do some range of motion exercises. So if you could please do chin to chest, which is flexion. Look up at the ceiling, which is extension. Can you please turn your head to the left, which is lateral rotation left. Turn your head to the right, which is lateral rotation right. Then if you could do your ear to your shoulder, which is lateral bend left, and then do lateral bend right. Great, and I'm going to do some strength with all of that. So I'm going to test spinal accessory, cranial nerve spinal accessory number 11. So if you could raise your shoulders up against me, great. And then push against my hand, and then push against my hand. Good, and that all is nice, and strength is a 5 throughout, so that's wonderful. My hands are cold, I apologize. So I'm going to test your carotid pulse. That's a 2+ regular. That is a 2+ regular. And now I'm going to use the bell of my stethoscope. Can you please take a deep breath in, let it out, and hold it on the out. Okay, let that air, breathe for a second. And when you're ready, take a deep breath in, let it out, hold it on the out. And breathe. I'm just going to palpate your trachea. Okay, and that is midline, no concerns with that. So looking at your overall thorax, your respiratory rate has been nice and even. It's somewhere between 12 and 20. I'm not concerned about it. You're not labored, and you're also not using any accessory muscle use, so I'm very happy with all of that. and your color is pink, you're not having any signs of cyanosis that would concern me. So can you please put your fingers like this? And I don't see any plumbing. Could you put your fingers like this? And I'll just quickly look for cap refill, which yours is less than 2, so that looks good. Wonderful. All right, I'm gonna go up behind you. So coming around behind you, I'm gonna sit up here just because I want them to go. Oh, actually, can you swing your leg around and straddle? Do you mind? Awesome. Okay. So from behind, I am just looking to see. You can come around here too. So I'm looking at her shoulders to see if they're symmetrical. Just slightly. And then after that, I want to palpate her thyroid. So I'm just going to slide my hands on either side. And can you please tilt your head to one side? Great. We're going to displace her thyroid, palpate one lobe, and then can you tilt your head to the other side? Displace and palpate again on this side. Okay. And now I'm going to palpate her thorax. So you can tell me if you have any pain or tenderness. Any pain or tenderness? No. Okay. Across her thorax. And I don't feel any masses or nodules or any kind of lesions under my fingers. So next I'm going to percuss in 12 points in the 6 areas bilaterally. So we use a ladder pattern. Can you lift up your arm, please? Good. Now I'm going to auscultate the bell with the diaphragm. Okay, take a deep breath in and out. Tell me if I'm going too fast. All right. For the demonstration, you can go ahead and just breathe normal while I do the rest of the landmarking. 5, 6, 7, 8, lift up, 9, 10, 11, 12. Great. And while I'm back here, I'm going to go ahead and do your CVA tendon. So you're going to feel some pounding, which I know is not a good description. Any pain or tenderness when you do that? Okay, can you swing back around? Right. Something I did not change on this rubric. So with the carotid on the rubric, it says you still need to state that it's atherosclerosis. I don't care if you say it. I took all the other significances off.
What are you talking about?
Yes, yes. I just forgot to take it off there. Because I used to be for a whole bunch of them and TikTok time. Okay, so looking at inspection of your anterior chest, I don't see any cardiac heaves or lifts. Now I'm going to palpate, so the 3 areas I'm going to use, and you said it's okay to touch your chest? All right, so I'm going to go across this way, and I don't feel any palpations or thrills. I'm going to go in between. I don't feel any palpations or thrills, and then here for the 3rd, and then my fingers are right about where I should be at the 5th intercostal space, mid-clavicular line. And so we have about a 1 centimeter light tapping 1+. So that's that. And now I'm going to get my, are you gonna come do it? You'll put the 1 minute on? Okay, so the proctor would come over. I am then going to do my placement. They're gonna grab here. I'm gonna listen. 3, 2, 1, 0. She's timing out a full minute because we're not gonna cheat for the minute. Any questions so far? Am I doing okay? Don't tell me if I missed anything. Am I doing okay? Sure. All right, so now I'm going to auscultate. Diaphragm first, aortic, pulmonic, herbs, tricuspid, mitral. I'll do it the real way. Aortic, pulmonic, tricuspid, see, herbs, tricuspid, and mitral. So your heart rate was a 68, was regular. Yeah, it was good. So, okay, so can you up here? I'm gonna do your pulses. So, no, that's good. So, radial is 2 plus regular. Ulnar is 2 plus regular. Brachial is 2 plus regular. And then got your epitrochlears. That's good. So now I'm going to palpate your upper extremities for tonicity, size and symmetry, and that's all good. So now we're going to do some movements. So to do this for your head to toe, I'm going to do passive on this side, you're going to do active on that side. So you're going to match what I do, right? So we're going to do flexion, extension, abduction, adduction, and then I want you to bend your elbow and come back like this, internal rotation, and then external rotation. And now we're going to do it with strength, right? So put your arms up like this, push up against, push down, push in, push out, put your arms like this, try to get out, and then push your arms like this, try to get out, and that's all 5 out of 5 strength. So now we're going to do elbows. Ready? Yes. Up like this. This is flexion, extension, and then I want you to supinate, pronate. So now I want you to put your arms, pull against me, push against me, put your hands like this, try to turn your hands over, put your hands like this, and then try to turn your hands over. Good. So now with your wrists, I want you to do flexion, extension, midline. I want you to do radial deviation, ulnar deviation. So now I want you to press up against my hands, and then put your hands up like this, push down against my hands, midline, pull in, and then pull out. And with your hands, yep, you're gonna spread your hands apart, and then make your hands into a fist on that side. And then I want you to squeeze my fingers, and then spread it out. All right, we've got 5 out of 5 here, 5 out of 5, and 5 out of here. Good. All right, so now I'm gonna have you lie back. Eventually. Can you turn your head to the left? So looking at her neck, I don't see any jugular venous distension. If I did, I would sit her to 45 degrees. If she continued to have jugular venous distension, I would put her up at 90 degrees and call the provider if there was there as well. So now, can you put your hands to your side? Wonderful. So looking at her abdomen, I don't see, her contour is flat. She is symmetrical, and I don't see any pulsations, and the umbilicus, can you point to where it is? It is midline, and I don't see any discoloration and striae or anything with that concern. So that's good. So now I'm going to go ahead and listen. I'm going to listen in all 4 areas. Diaphragm. Now I'm going to switch to the bell. Your belly button again. Okay, so from here I'm going to do 2 and slightly to the left, and that is aortic, right renal, left renal. left iliac, right iliac, right femoral, left femoral. And now I'm going to percuss. Palpate. Tell me if you're having any pain or tenderness.
No pain, no tenderness.
Great. So this is light palpation. Deep palpation. I'm going to do bimanual. 5 to 8. Feeling for masses or any enlargement of organs. Any pain or tenderness when I do this?
No, no.
Great. I'm not doing any specialties. So moving from here, I'm going to palpate inguinal lymph nodes. I don't feel any. I am going to take your femoral pulse, and it's 2+ regular. I'm going to auscultate for any bruise of the femoral artery. And I'm going to go ahead and go down because it makes more sense to me, and we are not doing this. We're going to go down here. Can I pop them off?
Yes, if you can.
I don't want to trip on them. So I'm gonna do, I'm actually gonna do posterior tibialis first, 2+ regular, and then I'm gonna do your dorsalis pedis. That is 2+ regular. I'm just gonna palpate your lower extremities in general for tonicity and size and symmetry, which the size is normal and symmetry throughout. I am looking to see if, so symmetry I've already commented on, hair distribution, so she's growing hair, that's a really good sign. There's no pretibial or pedal edema that is present, and her temperature in her legs is good. Vascularity I will check in a minute. So that all looks good. So now that we have done that, we can do some leg movements. So we're gonna do, you're gonna match it on this side in just a second. So nope, you don't need to do it at the same time.
Okay.
With no cord.
Yes,
Okay,
ma'am.
so we're just going to do flexion, extension. Go ahead.
Flexion, extension,
Abduction, adduction.
abduction, adduction.
I'm gonna bet your knee up like this. We're gonna do internal rotation, external rotation.
Okay.
Go ahead.
Internal rotation, external rotation.
Excellent, all right. So I want you to pull up against my hand. Oh, great, you can do it both at the same time. And then down. And then bend your knees up. Okay, push out. And then push in.
Perfect.
And then pull out. Pull in, I don't remember if I did that for some reason. Okay, so to bend your knee, I'm just gonna have you do flexion, extension, this one. Flexion, extension, and then what I want you to do is bend your knee up, kick out against me. Nope, like this, like there you go, and then pull back. And then bend this one up, kick out, and then back. Great. So I'm gonna keep going this way, just make life easier. So I want you to dorsiflex, plantar flex. I want you to invert, inversion, and then eversion. Great, pull up against my hands, push down against my hands, and pull, push in, push out. Good. Did I leave toe? Oh, I can't ask you. So I'm gonna have you curl your toes. I'm pretty sure I took it off. And then push up against my toes. Good, or my hands. I'm pretty sure I got rid of it. All right, I'm gonna test Babinski. So you're gonna feel some tickling on your feet, but since you're my patient, I know you don't respond. So it's gonna be negative. And then clonus, if you did.
5 minutes.
Thanks. So I'm gonna do this. Let go. So it's negative. Go ahead and sit up. All right. So just a couple more things. I want you to do your hands like this and do your hands like this. Find a gross motor. That's good. Can you walk with your shoes off? Sure. So now that you're standing, the first thing we're gonna do is feet together, hands at your side, close your eyes, arms out for safety. 1, 2, 20. Great. Now you can go ahead and walk that way. Coming back on your toes. And you walk back that way on your heels. and come back towards me, heel to toe like a tightrope. Excellent. So if you could just turn like this way, pull your pants up. And I don't see any I don't see any vascularities or phlebitis, varicose veins, or anything like that. So you can go ahead and have a seat up here. Something's bothering me.
You got 2 minutes.
Gotta remember, I just did this last week and it was the old version, so I'm like, did I need to do it on this one?
Do you like your hand?
I'm pretty sure, no. So, my dear, you have quite a bit of things we need to follow up with, just so you know, in HENT. Yeah, so do you have any questions? I'm gonna tell the provider, I'm gonna document, and I did not get 100, but I'm good. I did last week, so that's fine.
Are you done?
Yeah.
Okay. At least you